Hello, my name is Margarita Cañarte. My topic is about cholesterol embolizations after transcatheter aortic valve replacement. Definitions. Cholesterol crystal embolization is a rare disorder that results from the breakthrough into the bloodstreams of the cholesterol-rich matrix of an atheroma plaque. Cholesterol crystal lodge in small caliber arterioles, causing obstructions and generating an inflammatory response with consequent ischemic damage to the affected tissues. The clinical manifestations are multiple depending on the organ involved. It occurs in people with atheromatous diseases of spontaneous before or after the realizations of vascular manipulations, angiography, angioplasty procedures, cardiovascular surgery, or more rarely with the treatment with oral anticoagulants and after thrombolytic therapy.
Embolism.
Embolism is occlusion or obstruction of vessel by an embolus.
What is an embolus?
An embolus is a detached intravascular solid, liquid, or gaseous mass carried by the blood to a site distant from its origin.
Type of emboli.
Thromboemboli, atheroemboli, pulmonary emboli, fat emboli, air emboli, microemboli, parasitic emboli, parenchymal emboli, foreign body emboli. Now, we are going to see each type of emboli in detail.
Thromboembolism.
Thromboembolism is obstruction of a blood vessel by a blood clot that has become originate from another site in the circulation. Thromboemboli mainly originate in heart due to ischemic heart disease, arrhythmias, valvular disease and myocardial diseases such as myocarditis, cardiomyopathies and amyloidosis. Not only that, also
Thromboemboli can seen in ulcerated atheromatous plaques, aortic aneurysm, venous shunts in dialysis patients, deep veins of leg, thromboembolus at bifurcation of aorta. The affected tissue's vulnerability to anoxia cause infarction.
Pulmonary embolism.
pulmonary embolism is the sudden blockage of a major blood vessel in the lung, usually by a blood clot of blood. So pulmonary embolism is type of thromboemboli. In most cases, the clots are small and are
Applications in medicine. At present, a large number of cardiac valve replacements for prostheses are performed each year due to valve diseases, in order to influence their natural evolutions, improving prognosis and quality of life. Despite its usefulness in patients with valvular heart diseases, it is known that they can lead to serious and even fatal complications, among which are thrombosis of the prosthesis, systemic embolizations, bleeding due to the need for anticoagulations, structural alteration of the prosthesis, insufficiency, or valve stenosis.
TAVR is a minimal invasive procedure, stands for Transcatheter Aortic-Valve Replacement. Aortic stenosis is a disease of the aortic valve. The aortic valve is like the door of the heart, and when it becomes narrow, patients become symptomatic, meaning they have shortness of breath, chest pressure, sometimes they even pass out. So TAVR is a procedure that can replace the traditional open heart surgery. So the procedure starts with numbing both groins. We put lidocaine under the skin, and that prevents the patient from having pain. The patient will be under light sedation, and we will insert catheters. Catheters are plastic tubes that allows to inject contrast or advanced devices through them into the heart. We will then advance in an aortic valve bioprosthesis. Currently, at Tallahassee Memorial Healthcare, we have the two devices that are approved by the FDA to treat aortic stenosis. The Edwards valve is a balloon expandable valve. The valve is mounted on a balloon. So, as a stent, you will put it in the position that you prefer and then inflate the balloon. That will expand the valve. Once expanded, the valve is already functioning. The Medtronic valve is contained within the catheter. The Medtronic valve is made of a material called nitinol. Nitinol is a material that has memory, so that the valve is always wanted to be in the original position. We put it inside of the catheter, and once in position, we release it by removing the catheter. The valve deploys itself. By treating aortic stenosis with a TAVR, we are making patients live longer and better. That means no shortness of breath, or chest pain, or passing out while doing their regular activities or even exercise. The evidence has supported that the FDA has approved this therapy for people with intermediate risk for surgery. However, there are at least 2 trials that have shown that this is beneficial also for low-risk patients. So the population that will benefit from this procedure has broadened. The heart team is composed by several people, from cardiologists, invasive and non-invasive, heart surgeons, nurses, anesthesiologists, coordinators. We all are with one mission, which is to provide that patient the best option available.
Pros and cons. Cons. Patients with heterograph type bioprosthesis have a greater tendency to embolize during the first 3 months after replacement. In patients with mechanical prosthesis, the incidence of severe embolizations leads to persistent neurological deficit or death. Pros. The main benefit of mechanical valve prosthesis is that they are made of a highly durable material, so there is no structural deteriorations.
Transcatheter aortic valve implantation. What is aortic stenosis? Valves in the heart act as one-way doors that allow blood to flow out of the heart and close to prevent blood from flowing back. Aortic valve is the exit door of the left heart that allows blood to flow to the rest of the body. Aortic stenosis is a condition when the aortic valve becomes narrow, obstructing blood from flowing from the heart to the rest of the body. What are the symptoms? Typical symptoms of severe aortic stenosis include chest pain, shortness of breath, and fainting. Once symptoms occur with severe aortic stenosis, there's a 50% chance of dying within the next 2 to 5 years. What are the treatment options? Medical therapy alone for severe symptomatic aortic stenosis is generally ineffective. The primary treatment will be to replace the aortic valve. This can be done via open heart surgery or through less invasive alternative methods like TAVI. Your doctor will advise you on the best treatment option for your situation.
Issue applied in Ecuador. Aortic stenosis is one of the common cardiac degenerative valvular diseases, with a prevalence of 1.3% in patients between 65 and 74 years and 2.8 or 4.6% in patients measured 75 years of age.
Well, we moved to Manhattan Beach about 1959, and have no interest in leaving Manhattan Beach either. I was a veterinarian mainly in small animals, which involves dogs, cats, birds, and occasional exotic, being a mountain lion, this type of thing, dentistry with that. But I actually retired in 1990.
Roy and his wife were enjoying their retirement, but Roy started experiencing changes in his body.
I could feel something in my stomach, lower abdominal area, and I took my pulse and I found it to be very irregular.
He was still very active, doing all the things that he wanted to do in his life, but he started getting short of breath and more fatigue.
I thought, it's time to do something about this and check this thing out.
He was found to have severe symptomatic aortic stenosis.
Stenosis is a hardening of the heart valve. Until recently, the only option was open heart surgery.
And they said, you ought to see if you can be a candidate for the transcatheter method of repair, because you need to be repaired.
Conclusions. The implantation of valve prosthesis is not without complications, in addition to recurring anticoagulations, which in turn can generate significant problems. Prosthetic thrombosis is possible due to the temporary suspensions of anticoagulations, as well as severe secondary bleeding. Even bleeding with therapeutic anticoagulations values may occur. Thank you.